Okay, Caitlin, so we have yogurt. I'm going to give you 3 bites, okay? Take your bite.
A feeding disorder is characterized by a child's inability or refusal to eat sufficient variety or volume of foods to sustain their nutritional growth or psychosocial functioning. Our feeding disorder program, especially ours at the Harris Center, is really focusing on decreasing problematic mealtime behavior and increasing oral intake by mouth.
Kingland is our youngest of our 3 children. He's very vibrant, but also he's very stubborn. I feel like there's no barriers that with autism that kind of restricts him. Like you can see his personality shine through, whether that he's always smiling. He was a picky eater. So he was eating the same things over and over and over again. And usually if you put something in front of a child, more than likely whether it's broccoli or something that they dislike, they still eat it. And he wasn't. So we never had an issue with his weight or anything of that nature. He was always over the percentile. However, we knew that he was putting himself in an isolated category when it came to certain foods, and it was restricting us as parents to feed him, and we didn't know like pretty much where to go from there.
The goal of the program is to train parents on how to get their child to eat a variety of foods at a decent, age-appropriate volume in a variety of settings.
It's definitely worth coming here, investigating it, giving it a shot, having more than 1 or 2 visits, and actually
Absolutely.
really trying to
stick through the entire
yeah,
thing.
trying to really get into it to see the professionalism, the way your child will change, the way your child will embrace change, which is difficult for people who are on the spectrum because they like things to go a certain way. And it'll help them in their overall development. And that's what I took from this more than anything. It was, to me, beyond just feeding therapy. It actually helps them to be a better person.
To see my son eat a whole banana, like to an individual who has a neurological child, that may not be something. But for us to have a child on the autism spectrum to eat like an entire meal, and to see my son eat an entire meal that is offered a vegetable, a fruit, a starch, whereas it's just not Chick-fil-A, that speaks volumes to me. So it's like my husband said, if you're on the fence, or that's why you have the professionals and you build, like Dr. Roberts will forever be somebody that we will refer to. I have that type of rapport because that was somebody who saw something in our child and used their professional background to pull it out of him.
True.
Because if not, we would still be struggling on introducing certain things to Kingwood. So I will forever be grateful for Dr. Roberts for that.